Hey everyone, Sarah again. I've come to help you identify the bones on paper. So number 1 here, this is the frontal bone. Number 2 is the sphenoid bone. There's also a little bit of the sphenoid sticking out kind of on the edge of number 7 up here. That little hole in the back of the sphenoid bone, that is the optic canal that your optic nerve goes through. Number 3 is the maxilla. So the maxilla is this whole big bone that forms your upper jaw. Number 4 is the nasal bone. There's this tiny little bone next to the nasal bone right here and right here. That one is the lacrimal bone. Number 5 is the mandible. There's some parts of the mandible to know. This little hole right here, that's the mental foramen. There's another one on the other side, also the mental foramen. And this big part in front of the mandible, that's the body of the mandible. And then this right here is the angle of the mandible. And then the part coming up top is the ramus. Ramus means branch. So it's the ramus of the mandible. If we look down at our, we've got some other ones too. So number 6 is the zygomatic bone. Number 7 is a little bit hard to see on here, but that's the temporal bone. Number 8, the base of your division between your two nostrils, that's the vomer. And number 9 would be the ethmoid. The ethmoid extends upwards as well. These two little projections on the side are also part of the ethmoid. Those are the middle nasal concha. And below this, not part of the ethmoid, these two are the inferior nasal concha. If we look down at this next picture, we've got a few more of those things labeled. So number 5, like we said before, that's the lacrimal bone. 2 would be the optic canal. 4 is the middle nasal concha, part of the ethmoid bone. 3 is the inferior nasal concha. 6 would be the ramus of the mandible. 1 would be the mental foramen. And 7 would be the angle of the mandible. Flipping our page, we've got a side view now. So some of the things here we can see, this is the occipital bone, number 1. We can see the sutures. So the sutures are the joints between some of the skull bones. The suture that goes above the occipital bone, number 9 there, that's the lambdoid suture. This suture that goes along the top border of the temporal bone, number 10, that is the squamous suture. There's a suture that's unlabeled on here, this one right here. That's the coronal suture. Number 2, this is the parietal bone. There's another one on the other side. 4 is the temporal bone. There's also another one on the other side. 3 is the frontal bone, which extends over your whole forehead. 6 is the zygomatic bone, which we saw before. 5 is part of the sphenoid, which we can see more of on the inside of the skull. Here's the nasal bone again. And the lacrimal bone is this little one right in here. 7 would be the maxilla again. 8 is the mandible. This part of it again is the ramus. This edge is the angle. And this main part over here is the body of the mandible. And that little hole is the mental foramen. On this next picture, you can see some more things labeled. Let's start out with some of the parts of the temporal bone. So temporal bone was this bone here. Number 5 there, that's the external acoustic meatus, where your ear would be. 4 is the mastoid process. It's a little more massive than the other process, which is this pointy little styloid process, number 6. There's a muscle called the sternocleidomastoid that attaches to the mastoid process. The styloid process is pointy like a stylus. Number 7 is the zygomatic process. A process is going to be anything that sticks out of a bone. And the zygomatic process sticks to the zygomatic bone, which is this one up here. 8 was the coronal suture that we mentioned. And I think that's the main ones on that page. Looking at the back of the skull, we can see this sagittal suture there. It's on the mid-sagittal line and separates the two parietal bones. So 3 is one of the parietal bones. This would be your other parietal bone. That's your occipital bone. Number 2, that suture is the lambdoid suture that goes above the occipital bone. And number 5, we're just seeing the edge of the temporal bone over there. Looking down at this picture, number 1 here, that's a different view of the zygomatic process of the temporal bone. It's connecting to the zygomatic bone, which is up here. You can sort of see the joint between them there. We've got a couple parts of the occipital bone. So the occipital bone's this big one in back. Number 3 there, that big hole, is called the foramen magnum, which just means big hole. That is where your spinal cord comes out of the skull. Number 4, those two things are the occipital condyles. They are going to rest on top of the superior articular facets of the top vertebra, which is the atlas. There is a little depression right here. Depressions are called fossa, and that is going to be where your lower jaw, your mandible, fits onto your upper part of your skull, and there's another one right over here. So that is going to be your mandibular fossa. And then we've got these two holes, which are on both sides. The top one, which is smaller, that's the carotid canal, where your carotid artery goes through. And this bottom one that's kind of wider is the jugular foramen, where your jugular vein goes through. Veins tend to have wider lumens or openings on the inside, so the whole thing tends to be wider than an artery. The arteries have to have a smaller lumen to be able to create more pressure for the blood to go. Number 7 up here, this is the palatine bone. And number 8, this is part of the maxilla, and it's called the palatine process. Okay. Skipping to our next page. Now we're looking on the inside of the skull. Number 1 here, that's still part of the frontal bone. Number 2, this is the sphenoid. This is this large one right here. Not labeled with a number on here, but this kind of triangular area, this is part of the ethmoid. And if we were labeling all those little holes, those are the olfactory foramina. We can still see the temporal bone, the foramen magnum, and the occipital bone. If I was to circle like this whole area, that's a big depression called the anterior cranial fossa. And this area is a big depression called the middle cranial fossa. And then this big area in back is the posterior cranial fossa. So those are the large depressions, 3 of them inside of the skull. So hopefully that helps you with your skull bones.